Men are tailoring for at least 60 hours of work a week, according to the TUC report. The four main stressors are internal, external, personal factors, and occupational factors. So internal stressors are the things we think about. So that's past experiences, memories, self-worth, and stuff that's kind of like happened on us in the past. External stressors are the things that surround us, so competition in football matches or any other like sort of competition, and the weather, so when it's raining extremely heavily or it's too hot. Personal factors are the people we share our lives with, so this is family, friends, partners, any form of relative, and other life factors such as money and health. Occupational factors are the jobs that individuals undertake, so it's the job that we work in our spare time to earn money. Yeah, so you see, and the working conditions of that job and the people who we work with. The causes of stress are being under lots of pressure, which kind of puts you in the wrong mindset. Facing big changes, so you're not used to changes because you're not used to this one thing and now it's completely different. Worrying about something, because obviously your mind's off it. Not having much or any control of the outcome of the situation because you're powerless. Having responsibilities that are seeming overwhelming, or not having enough work activities or change in life. Common causes of stress at work: excessively high workloads with unrealistic deadlines and feeling rushed, which means to like not perfected work. Insufficient workloads. Feeling skills are being underused, so obviously your skills aren't being used to their full potential. A lack of control over work activities, so obviously you don't get to pick what you can do. A lack of interpersonal support or poor working relationship leading to a sense of isolation, so obviously you don't have that kind of comfort around you. And being asked to do a job with no or insufficient work experience or training, so obviously you have the lack of knowledge and you feel that you can't do the job to the best of your ability. The health risks associated with stress are increased depression, because obviously you're feeling down, you have all this work on top of you and you just can't do it. Headaches, because obviously you're overthinking it. Weakened immune system, so obviously you're more prone to illnesses. Risk of heart attack, because the amount of stress you're actually putting yourself under. Stomach ache. Fertility problems, because obviously you're in discomfort, you're not really in a comfortable situation. And tense muscles, so you're more prone to pull a muscle in football. The symptoms that chronic stress causes are irritability, anxiety, depression, headache, and insomnia. Diet. The guidelines and recommendations that the NHS put out are: you should have carbohydrates 50 to 60%, protein 10 to 15%, fat 25 to 30%. You should have vitamins, minerals, at least 18 grams of fibre per day, 8 glasses of water a day, and adults should have no more than 30 grams of sugar a day in order to keep a healthy diet. The NHS recommends, in an 8-tip base, is number 1, base meals on starchy carbohydrates. 2, eat lots of fruit and vegetables, at least 5 a day. 3, eat more fish, including a protein of oily fish, or portion, sorry. 4, cut down on saturated fat and sugar. 5, get active and be a healthy weight, so obviously stay fit. 6, don't get thirsty, so you're always hydrated. And 7, don't skip breakfast, because it's important. The Eat Well plate. Basically, this Eat Well plate is based on main food groups together that provides a healthy diet and also helps you keep a balanced diet and weight. So this will consist of potatoes, bread, rice, pasta, and other starchy carbohydrates, fruit and vegetables, dairy and alternatives, beans, pulses, fish, eggs, meat, and other portions or proteins. The benefits of keeping a healthy diet is it provides the energy that you need to keep active throughout the day, so that you can perform simple tasks, or even if it's a little task of, say, making your bed. The nutrients needed for growth and repair, helping the individual to stay strong and healthy, which will also prevent diet-related illnesses. Maintaining a healthy weight and eating a balanced diet, which is low in saturated fat and high in fibre and whole grains, and help reduce the risk of type 2 diabetes from developing. The risk of heart disease can also be reduced by having a healthy diet that includes rich in fruits, vegetables, low-fat dairy, and whole grains, which maintains blood pressure and cholesterol levels. A diet which is rich in calcium keeps your bone and teeth strong, and can also help you slow down bone loss, osteoporosis, associated with people getting older, which occurs mostly in your lower back. And eating a diet which includes lots of vegetables, fruits, whole grains, and a moderate amount of unsaturated fats, dairy, and meat can help an individual to maintain a steady weight and have control over their own weight. The effects of poor nutrition. So hypertension, this is when there's high blood pressure, so eating too much junk food, fried food, salt, sugar, dairy products, caffeine and refined food can all cause hypertension because all the amount of sugar you actually put into your system. High cholesterol and heart disease. So the National Institute of Health reports that more than 500,000 people in the United States die each year due to heart disease, which can be caused